The CDC Advisory Committee is meeting for a second day to discuss new vaccine recommendations, and it just tabled a vote on making new recommendations for hepatitis B vaccines. Let's bring in senior national correspondent Mark Strassmann. He is outside the CDC's headquarters there in Atlanta. Good morning to you, Mark. Bring some clarity to our viewers. What happened with that Hep B vote, and are they still expected to vote on a COVID-19 vaccine?
Good morning, Earl. First of all, on the hepatitis B vote, they just decided to table it, so it's not going to happen today. It's going to happen apparently at the next time this committee gets to meet. The change was supposed to be, as most parents know, right now the way it typically works is that a newborn gets the hepatitis B vaccine almost on day one. This change the recommendation would be to postpone until that baby turns 1 month old. But again, that vote was tabled. But the issue that is getting more attention today is the COVID-19 vaccine and whether to restrict access to it. Right now, we're all used to having the choice about whether to get the vaccine. What the committee is discussing now is whether to restrict that access to higher risk people, that is, people who are either 65 or 75 years old and up, or people who are younger than that but have some medical complication that puts them in a higher risk category, and then typically only with a doctor's prescription. So that would be a fundamental change. And right now they're discussing the safety of the COVID-19 vaccine, its history, people who've had significant medical side effects from the vaccine, but we expect a vote sometime mid-afternoon today.
And Mark, most of our viewers will have heard of this vaccine advisory panel. It's well respected, it's highly trusted, but if we listen to the former CDC director who was ousted this year after confirmation, she said her worry with Robert F. Kennedy Jr., the HHS secretary, is that many of his decisions do not seem to be based on science and measurable fact. Rather, it's about opinion. And he handpicked members of this CDC panel, including 5 of them just this week. How does he and how do they inform that overall decision making?
Well, it's a good question because obviously she wasn't the only one ousted. I mean, Kennedy, in effect, fired all 17 members of the old committee and there are a dozen members of this new committee, and he put them all into place. Many of them have expressed suspicions about vaccines and are seen by vaccine supporters as true vaccine critics. And so in the eyes of a lot of supporters, Kennedy has stacked the deck here. Now, this committee has taken great pains to say we are open-minded about vaccines. We just want to make the right choices. And so that's where we are. I mean, clearly, this is under a great deal of scrutiny, and clearly the credibility of this committee is on the line here, depending what they do. But whatever they do, whatever way they vote on these different vaccines, what is guaranteed is that somebody is going to be outraged about it. There's going to be one side or the other side that is not going to be happy with whatever they decide.
Yeah, and we heard this morning that part of the reason the Hep B vote was tabled was one of the previous members of the panel was trying to interject, was trying to speak, was then muted. So there was some conflict, some clashes happening behind the scenes. And we understand they may vote again at 2. Mark Strassmann, stay close. We'll get updates from you joining us from Atlanta. Mark, thank you.